Good morning and welcome to Shift. We decided to do this little segment with Scott and Kelly Morrison because we had them here about 4 or 5 months ago, and our theme was coming together and really trying to cross the divide. What has happened this past few weeks has really brought people together, and a paradigm shift has happened. So today we're going to talk with Scott and Kelly again, and we just want to get a little update from the state of Minnesota, what you have been doing as lawmakers, and then as we go on, we'll talk about your role as physicians and how we can all continue to come together because this might go on a while. So, you have been busy working in the legislature since we last talked. What kind of progress have you made?
Well, thank you for doing this morning and for having both of us. I think we're grateful for the opportunity to connect with each other and with people as well. I think we're all feeling that right now. We are in unprecedented times. I haven't used that word as often as I have lately, but it's the reality. And the legislature is hard at work remotely. The governor is hard at work, both remotely and otherwise. And I think that there will be silver linings to the situation, and one of those is that I think we're all back to being Minnesotans and Americans and finding our way to help each other to get through this.
Thank you, Jerry, for letting Representative Kelly Morrison and myself, Senator Scott Jensen, be here. Today, I think it'll be a wonderful opportunity for us to talk about some of the things we're doing at the Capitol, not related to COVID-19, but obviously I think we're going to want to share some thoughts about COVID-19 as well, because I think that Dr. Morrison and I do both have a unique perspective, being lawmakers and, if you will, physicians in the trenches. We're not some ivory tower academician. We're getting phone calls every day and trying to help and support our patients and their loved ones in this crisis.
We talked about the insulin bill. We talked about prescription drugs. How about giving us a level set on the prescription drugs?
Well, perhaps I should start on the Prescription Drug Affordability Commission bill, because that was my baby to start with, but I have not made a great deal of traction in my body in the Senate, and Representative Morrison has been able to be very effective moving it forward in her House body. It's a bill basically that says that we're going to look at certain drugs. If generic drugs are going up a certain percentage, or if trade name drugs are coming out, perhaps at $10,000, $20,000 a year, tell us why. Let's have some transparency, and let's put an argument together as to why a drug might come out and be $150,000. In the Republican Senate, we've not been able to get a hearing. So I'm extremely grateful to Representative Morrison for her effective leadership in the House, where not only has she gotten hearings, she's been able to pass the bill through hearings. And she keeps asking me, when are you going to get something done? I'm trying, but I think on my side of the aisle, there's a perception that it has too much to do with regulation. And I think small, thoughtful measures of regulation are things that we have to do, especially in monopolizing industries.
There's so much we could talk about in the space of prescription drugs. I think it's on the forefront of many of our minds. Prescription drugs impact nearly every Minnesotan, whether it's yourself or a family member, and we're all very aware that the prices have gotten out of reach for many of us. And so the Prescription Drug Affordability Commission that Senator Jensen and I are sponsoring, we see as a way to address this issue. So it has thresholds above which a drug is triggered to be reviewed by this independent commission, and it gives them the authority to set a maximum reimbursement level if a drug presents an affordability challenge for a patient or our healthcare system. This is a very reasonable approach that has been used in 2 other states already. There are many other states who are looking into it. it's a reasonable way to address the challenge of the skyrocketing price of prescription drugs. I thought it was interesting that in the Star and Tribune this morning, there was a rundown of the amount of money that's being spent by lobbyists. And it's no surprise that Big Pharma and specifically the three big insulin manufacturers have increased their spending dramatically this past session. They don't like this, and they are about the only actor, the only stakeholder in this conversation who doesn't like it. Most of us are pretty united that we need to do something about the cost of prescription drugs in our state.
Thank you, Representative Morrison. I think one other clarifying item regarding our bill is that we're not saying that we're going to set prices. We're asking, tell us how much money went into research and development. Tell us why this is going to be $150,000 a year. Is it because the ingredients are so difficult to obtain or so difficult to produce? We're simply saying, tell us why. If you don't have a compelling argument, then this commission would have the authority to set an upper payment limit above which no public or private plan could pay more. And this is what Canada does, and Germany, and many first world countries do. Before a medication gets released, the price that is being proposed has to be justified. And to Representative Morrison's point about lobbyists and spending money, they are very good at playing that game whack-a-mole. Wherever they have to go in our United States, they will go and they will hammer it until it gets defeated, and they'll be ready to come back another day. And they also play it on another level. They'll go to Minnesota, and every bill that they think could adversely impact the way they do business, they'll play whack-a-mole there too, and they'll whack every one of those bills down, whether it's a Prescription Affordability Commission bill or whether it's an insulin bill.
So what can people do if they're interested? You seem to be making progress in the House. The Senate is another story. Is it reaching out to lawmakers?
Absolutely. That always makes a difference. Lawmakers have to be responsive to their constituents. So if you reach out to your state representative and probably specifically to your state senator and tell them that you support this Affordability Commission, that can make a difference.
We are elected to lead, not snuff out conversations that Minnesota has made very clear that they would like to have. I think that every Republican senator should receive at least 50 postcards from constituents of theirs asking the one question: why wouldn't you robustly get behind having a conversation in a committee hearing?
So guys, I guess at this point, we've got nothing but time, right? Everybody's home. You can contact your legislator via email. You can, as you said, send a postcard. You can probably give a call, and somehow you're be routed to at least a voicemail, I would guess. So.
And if you wanted to target your postcards and your inquiries, without meaning to be too bold, I would simply say that in our Senate caucus, Senator Michelle Benson and Senator Paul Gazelka have the most to do whether or not we'll get a hearing.
Right. Let's move on to what's happening in the state. People not able to work, lots of calls into Steve Gove's office. How do you see that kind of working from your end? I mean, does Minnesota have the money to be able to do this? Do we have the infrastructure to be able to process these claims? As people are maybe watching, what can they expect?
Well, I'm grateful that we have an outstanding Department of Public Health in Minnesota. We really have one of the best in the country, so we are incredibly fortunate in that way. I use the word unprecedented again. These are unprecedented times, and our governor and our legislature and our commissioners are working around the clock to figure this out and to respond in the best way possible. And I think that we, thus far, have gotten great leadership from the governor and from our commissioners. We are in the enviable position of having a surplus, although I don't think it was quite as robust as was reported initially. And I appreciated that the governor scaled back on some of his early recommendations as it was becoming clear that this was going to be a big problem, so that we have saved money for this impending emergency that we're facing. So I feel good about our state's ability to respond, and I think people should be reassured that we have some good leadership in place.
Are you getting calls to your offices about this in particular, the unemployment in particular? Yeah.
Yeah, many, yes, absolutely. Many of us are hurting and frightened and unsure about what this is going to look like. We need to have money to continue to buy food and take care of our families and survive. And many of us are being asked not to work, and that is a very frightening position. So I'm glad that resources are being called up to help our people.
I think of taxes. I know our federal taxes have been pushed. Has anything been announced for the state taxes?
I don't think anything's been formally announced, but there's a lot of conversation about matching up with
Yeah,
federal.
I would imagine the state and counties as well, although, I'm sure they need the money for operating.
All the king's horses and all the king's men couldn't put Humpty together again. That's where we're at. We looked at containment for a period of time with the COVID-19 disease, and we understand that that's not doable. So now we've moved into that area of mitigation and suppression. We're trying to take a Rocky Mountain peak and squash it so that it looks more like a rolling hill, and in that way not overwhelm our medical facilities. That's good. But we need to make certain that we're not throwing mud against the wall to see what sticks. We're on the brink of making decisions that will have potentially lasting impact far beyond what COVID-19 will have. We will get past this. This morning I read quite a bit about the 1952 polio epidemic, and I read about the fear and the apprehension and the need for making difficult decisions. We're in that same area. Numbers without context are difficult for people to understand. But I think closing schools is not a slam dunk decision. In Hong Kong and Singapore, we had two contrasting situations. And public health people and epidemiologists and physicians and scientists and statisticians have come out and said, it's not so clear here. Britain came out recently with some of the prevention of businesses moving forward may not be helping at all. So there's a lot of things to be concerned about. I don't think we have any kind of a surplus right now. I think, frankly, if you look at our finances in Minnesota, we have absolutely flipped the other way, and we will have a deficit. We're spending money like there's no tomorrow, and we're not exactly certain what we're trying to do. So I'm quite pessimistic in that regard. But I know that we'll get through this, and we'll get through it not because of our politicians. We'll get through it because of the people of America.
I am old enough to have had a grandfather who survived both World War I, World War II, the Depression, and my cousin reminded our family this week about what my grandpa Gus said when he was asked about, did you ever think you'd get through it? And my grandfather sighed and said, well, we were young. And my grandparents lived always with hope. And they had gotten through the worst of times. And as you know, that generation tended to be pretty careful, but they came back. And I think that, we haven't had hard times to speak of, anything that has been this sort of possibly devastating. And so I think we can look to that and to, of course, our faith. Our faith always gives us hope.
Absolutely. I think if you're a person of faith or not, it's hard not to see this moment as a little bit of a pause and a reordering for us to get back to really the bare essentials of what is important in life. Pausing, slowing down, being with family, connecting with friends on the internet. It's interesting, but there will be silver linings.
About 10 days ago, I was having breakfast at a restaurant with a gentleman, and our waitress happened to overhear some of our conversation about the coronavirus. And she knew me from church. And she said, well, I know that the opposite of faith is fear, so I don't want to go there. And I challenged her, and I said, I don't think that's true. Fear is not the opposite of faith. The opposite of faith is letting your fear deter your faith. It's what you do with it. C.S. Lewis once said that the people that he had talked to who had sort of fallen away from their faith had never really been reasoned out of it. It just sort of went into hibernation. And he said that's why he thinks that we need to all elevate those aspects of our faith in our daily lives so that we can indeed be courageous. When Paul said, "O death, where art thou sting?" he wasn't trying to come up with some political slogan. He was simply acknowledging the profession of faith that said, death has no sting to me. And I think as Christians, I think we should be able to translate that into our daily comments and lives today. We don't need to be snarky. We can be kind, we can be thankful, we can be thoughtful. We can say, we're going to rise above the fray. Yes, people will get sick. Some people will get very sick. Some people will die. That happens every year. In Minnesota, we have almost 10,000 people die every day. Now, we may not be intimately embracing these statistics on a daily basis, but they're there. Just because we haven't been paying attention doesn't make them any less real. So when we talk about 400 or 500 people dying every day in Italy from coronavirus, remember that 10,000 people, excuse me, I said 10,000 in Minnesota, I meant in our nation. There's 10,000 people dying in our country every day. So I think that we really need to pay attention to context. We need to be all that we can be. We need to be the best version today of ourselves, because most likely most of us are going to get a bunch of more tomorrows to live.
Yeah. Let's go to your work as physicians. How are you working? How are you taking patients? How are you communicating with them? People having babies?
You know, it's interesting. I took a leave from my practice when the legislature is in session, but I've been in close contact with my colleagues, and they are actually currently paring down the number of physicians who are working in our group because we want to minimize both the number of patient visits. We're going to some telehealth options for people who aren't sick, who have a low-risk pregnancy, for example. But I think all of us are kind of girding ourselves for the potential to need to be kind of called up to duty. So there's sort of this contraction going on right now before there's probably the potential for a lot more work.
The organization I work with has a multitude of specialties, so each specialty area has had to make its own decisions. Some things are more elective than others. I happen to believe that in primary care, our being there daily is not elective. So when the legislature cut down, I increased my hours. I typically am in the office during the legislative session 3 days a week, and now I'm in the office 5 days a week. We've got patients with congestive heart failure, respiratory illnesses, emphysema, and we need to be there for them. Will I get exposed? Do I get exposed? Every day, every week, every month, every year. That comes with the territory. So if my life is jeopardized because of that, so be it. That's just the way it is. I think that we have to be very careful to not allow vital supply chains to be interrupted. We already know that some of the medications we prescribe daily, the ingredients are no longer able to come in. And so we're not even being told which medicines they are, because that might cause, if you will, a run on the bank. But the bottom line is, this is a time to be courageous as well. And if you look at the actual data surrounding what COVID-19 looks like, if you're healthy and not particularly aged, this is going to hold minimal risk to you. I mean, there'll be some days more people dying in motor vehicle accidents and suicide than from COVID-19.
I would push back a little bit on my friend Dr. Jensen and just remind people that 40% of hospitalizations right now are between the ages of 20 and 54. So we really all need to conduct ourselves like we have been exposed and infected. We need to be vigilant and careful, and just, we all need to practice this social distancing, this new expression that has come into very common parlance very quickly. Young people are not immune. Young people have less risk of dying from COVID, certainly, but they can still become ill. So we need to be careful.
And I would need to push back on my colleague, Representative Morrison. I would remind her that we have had a total of 12 admissions for coronavirus in the state. And that while hospitals are girding up for that overwhelming of the facilities. The fact of the matter is, we have scant data to base these assessments on. Granted, we have other states, but if you actually look at the United States, we have certain pockets where the disease has really gone rampant. In Minnesota, 2/3 of the counties have had no cases of COVID-19. So,
But it's spreading.
excuse me?
There are more counties
Oh,
today.
to be sure,
I mean,
to be sure.
yeah.
And we know it's going to be worse. I think the infectious disease person, Chris Ersman, however you say her name,
Right.
she came out and someone said, well, do you think it's factual that for every documented case of COVID-19, there's another 11? You could multiply it by 11, because that was what a study out of Columbia University had come out with in the last few days. And she said, well, I think that's probably a gross understatement. She said, it may well be 100 cases. Well, let's look at the bright side of that. That means that instead of having 137 cases, we actually may well have something like 13,000 cases already out there. And I think that we just need to be thoughtful, because this is a mild disease. And we've had flu epidemics that have taken far more of a toll than this one. And if we look at the swine flu in 2009, we can follow the pattern there and see what happened. We will take care of this, and the battleground is our immune systems. We have to be exposed. We can't get around it. The question is how fast, how quick.
I would encourage people to rely on the World Health Organization, the CDC, and the Minnesota Department of Health for the best information. Be careful online. There's a lot of misinformation out there right now. I would stick to those 3 sources as the best sources currently.
Yes, please, please, please don't.
I would stick
There
to-
is so much misinformation.
I would encourage everybody to read the opinion page today by Mike Osterholm. He wrote an excellent and compelling article, and he talked a little bit about the day after. What's this going to look like? Dr. Osterholm has been consulted by the president, by the governor, and around the world over and over again. And he also is saying, we need to be cautious. And so nobody should let go of their own ability to analyze things and that, but good information is important. But even the CDC has come out saying closing schools doesn't necessarily provide any assurance. So everybody's going to be inclined to grab onto what they want to grab onto to recruit other people to their viewpoint. That's what humans do.
Yep. And Dr. Jensen's talking about commentary opinion in the Star Tribune, which I believe all the COVID information they're allowing free. So I think that's available for everyone.
I thought it was interesting. That was a fantastic article, and he is, we should all be very proud that he is
Yes.
ours. He's a remarkable intellect and a very knowledgeable infectious disease expert. But one of the things he says in the article is things will never be the same again. That's not an exact quote, but to a degree. And it makes me think about your story about your grandfather. Those of us who had grandparents or parents who survived the Great Depression, that changed the way they lived forever. And he made the point that this may change the way that we live forever, hopefully for the better. There are a lot of upside to what the lessons that people learned during the Depression, to be frugal and careful and to not overuse resources. And some of that will probably translate into our life in the future. And all of that isn't a bad thing.
No, and getting along. I have noticed families out. I mean, and it makes me smile. That's a really cool thing.
I think it was also interesting in Dr. Osterholm's commentary that he used the future tense in regards to a new normal. And what I thought he was saying, and I would agree with him completely, is what we're living through today is not the new normal. There will be a new normal, just as there was a new normal developing after 9/11. But what we're doing today is some immediate and urgent measures to try to mitigate the number of deaths that we can have. I think it might be appropriate to also talk about some of the good things happening. This morning, it was released that by the end of next week, we will have testing capabilities that will be able to have a turnaround time of less than an hour. That's important. The more we identify who has disease, the more we can go target those people. And not target them in a bad way, but advising them, okay, you have the disease. You are probably shedding virus. We need you to self-quarantine. that's actually what some of the initiatives in various countries have been most successful. Not necessarily doing across the board in shelter, if you will, quarantining, but instead trying to find out where's the disease at. What we want to do is we want to have the ability to test, and if you're negative, we may well want to test again in a month. We want people to get that, and we don't have that capability today. I think Abbott labs are coming out. We're now starting to look at, for those people that do get ill and land in the hospital, there may be some new uses of medications that are old-time medications that may be helpful. And the vaccine development is ramped up. We have been moving things along, and we are now more than 2 months in advance than what we thought we would be in terms of developing a vaccine. 6 days ago, we started human trials for the vaccines. These are exciting times. We will get through this. But in the meantime, we do have an obligation to be measured, thoughtful, and making certain that we're not throwing Humpty Dumpty onto the ground so badly that we can't put him back together again.
Agreed. We do have a YouTube account, and you can ask questions if you like, or you may text. But I think that we will conclude our time together. And I think our message is united in carry on, be careful, have faith. Thank you for joining us.
Thank you so much for having us, and everyone take good care out there.
Thank you, and we're going to get through this.